Well, good morning, everybody, and thank you so much for taking time on a busy Friday to be here. We're here to learn more about the impact we are facing here in Missoula as a result of crises worsened by the pandemic. We know that COVID didn't create economic hardship and job loss, homelessness, mental health challenges, substance abuse, but we do know that they were all exacerbated by COVID. Over the last 2 years, Missoula has launched innovative approaches to crisis intervention, programs that work, that are changing and saving lives. Our panelists will tell us more about how these services have helped make a difference for people in crisis and for our larger community. We are at a critical juncture now. Our county has used one-time federal pandemic funds to provide these important services. That one-time source is running out and ending soon, but the problems, of course, remain. The crisis intervention levy on the current ballot would provide funds to help sustain these services, and we will be discussing the potential impact of the levy as part of this panel event. This event is being videotaped by Missoula Community Access Television as part of its media assistance grants to nonprofit organizations. I always like to give a plug for MCAT. They provide such an important community service. They serve the Missoula area on cable channels 189 and 190, so thank you, MCAT. Now I would like to introduce our distinguished panelists. First, Jeremy Williams is Director of Psychiatric Services at Providence Health St. Patrick Hospital. Jen Malloy is an assistant professor in the UM School of Social Work. She is here representing her own views as a community member, social worker, and an educator. Matt Musum is the owner of Warden's Market and Deli, a downtown Missoula institution. John Petroff is the Mobile Support Team Operations Manager for the City of Missoula, and he is here to provide information about the Mobile Support Team. And last but by no means least, Shannon Flanagan, the owner of Flanagan Motors Mazda, and he is the campaign treasurer for the Crisis Intervention Levy Passage campaign. So to get us started, I hope that you can each tell us what you've seen in terms of impacts of crisis on our community. And I'm going to start with you, Jeremy. I know there has been a significant impact at St. Pat's over the last 2 years. And so what's been the impact on our local health system?
Yeah, so I'll just start back in 2019 up until here earlier this year. What we've really seen is a 30% increase in patients coming to our emergency departments seeking either mental health or substance use treatment services. And so that just varies on acuity. Sometimes it's somebody who comes in a really acute crisis. Other people are just trying to seek resources. Also, what we're seeing is 1 out of 4 of these avoidable ED visits. That means folks that could find care at a lower level of care rather than coming to an emergency department. We're seeing that in our emergency department as well. And so that's where really the impact of this levy, when you're looking at hospital-based services, where that really the biggest impact comes. You know, catching people before they come into the ED. I mean, these are our coworkers, our family, our friends. These are folks that are coming and trying to look for services. And, you know, if we're having more of these downstream access points for folks, you know, we can look at avoiding ED visits, but then also trying to get people resources a whole lot quicker rather than going into an acute ED visit when really it could have been avoided.
Thank you. I have to remember to use the microphone. Jan, you and I were talking earlier, and I mentioned how UM practicum students, MSW students, really have done so much work increasing the capacity of local service providers, and those students interact with people in crisis throughout our county. So what have those experiences been like during the pandemic, and what impact do you see in the community?
Well, I think I really want to speak, I can speak as from a researcher hat, my social worker hat, my educator hat, but really as a community member. And I think we all have been witnessing as we move through our community, just so much more, right? Pain, houselessness, mental health challenges, substance use. And these are, as Jeremy kind of noted, these are our fellow community members, these are our neighbors, these are our people's siblings, family members. And so when I'm speaking with students and they're sharing what they're encountering in their practicums throughout the community, they're really speaking about the humanity of people, right? And the desperation and the lack of ability of our systems to really meet the needs. So both to address the root causes, but also even to alleviate what that momentary kind of assistance and relief, that these systems are cumbersome and hard to navigate when you're already in a challenged state of mind or situation. And so what I see the potential of this is really it's multi-generational work. It's increasing the capacity of our community to support individuals and families who are in crisis. And to really, we'll see the impacts of this in a thriving community in years to come. So if we're really thinking about how do we want to be as a community, how do we want to serve and care for one another, my research has really sought to understand the needs of people and what community responses around the nation look like. And I can say that these are proactive and effective practices that we're trying to engage in and continue. And so I really hope that we can see how this will benefit us, not just in this moment of real need, but actually for many generations to come.
Thank you. Matt, I'm going to skip you momentarily and go to John, because the mobile support team is one of the innovative ways we've heard a lot about it and how it has helped people experiencing crisis. I have friends who have had to use the services and had good results. But can you talk about what you've been seeing and how your team helps people in mental health crisis?
Yeah. So we've been in operation for just about 2 years now. So it still is a pretty new program. The one thing that we've seen is, just through the fire department, we know that people are suffering. People are suffering from mental health crisis, and in the past, we've only been able to send law enforcement. We've been able to send, firefighters or EMS. And so this team responds in a van, and they respond to people without an agenda. And that just changes the way we can interact with people. When we show up and we actually really do meet people where they're at, we're able to provide them with some guidance that they're willing to be a part of. So it's not us telling them what to do, it's us asking what they need. And that's where a lot of these other services come in, and we're working collaboratively with the hospitals, with other agencies, and really trying to be a resource that can connect to longer term resources, which then relieves a lot of the 911 system piece of it. So it is about like getting out of our silos and being a team throughout the community. And that's why all of these programs and every organization that we're working with is so important. Being a part of all of that is really beneficial.
Can you talk a little, two things that I think people are interested in. One is sometimes I think people think that these are services solely for unhoused people, and maybe just talk about some of the statistics that in that regard, and also just in terms of cost savings for the cost effectiveness of your program.
Yeah, absolutely. So so the cost savings, average ED visits about $2,000. That was done a couple years ago, about $2,000. One of our main goals of the program is emergency department diversions, jail diversions, and then taking other responders off scene. We saw that there was, last year alone, there is a little over 400 ER diversions, excuse me. So when we take that times $2,000, that's a cost savings to that client. It's a cost savings to the system. It's not necessarily to the taxpayers, but it is a cost savings and less traumatizing for those individuals in crisis. You know, when we're talking financial stuff, that could be a big impact on whether they're able to connect to new resources and that. I'm sorry, what was the first data point you wanted?
Oh, I think people are interested in unhoused versus
Yeah.
housed, that this isn't
Yeah.
just for,
Yeah, absolutely.
one
Sorry.
population.
Yeah, so that's if you've heard, we're working on data stuff still, but our last data that we pulled, we're still over 60% of the time we're responding to people that are housed within our community. We do work with unhoused as well because they're in crisis, but it is not just the unhoused. Over 60% of the time we are working with housed individuals. 1 in 5 Americans will suffer a mental health crisis, as you've heard from probably lots of people in the past. They're going to suffer from mental health crisis in the next year, and those are family members. We're seeing this in all ages as well, so it's not just adults, it's kids, it's everybody in America right now. There's a lot of people that are suffering. So,
Thank you.
yeah.
Okay, Matt, now I'm going back to you as a downtown business owner. And maybe you could speak to I know you don't speak for all business owners, but speaking of your own experience as a prominent business that's been in our town for a long time and has certainly seen lots of unhoused people camping, and how do you see this levy affecting your business and the community?
Well, as a small business owner, as a business owner in Missoula, my experience is probably a little different, but much the same as any other business owners and probably most of us as community members. I drive down Higgins every morning on my way to work, and I see groups of folks sleeping in doorways, sleeping in alleyways, and these are people that are there for some safety in numbers and trying to get some protection from the elements. In the winter months, we see a decline in the number of folks that are sort of visible to us, but it definitely runs the risk of being an out-of-sight, out-of-mind issue. There may be the assumption, as many of us do, that those folks have found shelter, they've found housing, they've moved along to another place, but I think it's really important to remember that quite a few of them have been through the shelter system, and that's no longer an option to them. And now they're being further marginalized because they need to get out of downtown, and they need to find a place to camp or a place to feel like they can be safe. And so it's just, we have a higher population of homeless and transient people in Missoula in the summertime, but when the winter months come, that doesn't necessarily mean that the issue has gone away. The effects on us as businesses, it's going to be a little bit different for each business. The folks that are sleeping in doorways and are up to go and get about their day, they become part of the community, as they're always part of the community. But now they're finding something to do. And as a person that's experiencing crisis or is homeless, many times we say there's all day, and there's really nothing to do with that day. And so that can be a mental challenge, I think, and a physical challenge for folks. So we have tried to keep folks from aggregating around the store at Warden's, it's been a long time thing that we've tried to do. And we do so very respectfully, and we do so in a very interactive way. And folks understand our motivations, and they're just very understanding of what we're going for. But what happens is we move people along, and they go down the street, and so now it's a stress on the next block or the next business. The alternative, which is to not move people along, puts a greater strain on businesses, and then becomes more of a strain on the community as well, because it's just, we've seen in other larger cities and places that have just bigger problems in a way. That becomes impactful. So, that's something for us, I think, to consider in how we, provide services to folks that are in these situations. But I think it's also very important to remember that we're all members of the community. That homeless folks and people in crisis and people that are having some insecurities are not them. They're part of the us of things. And so we have a responsibility as humans and as community members to try to serve each other. And at Wardens, we get a chance to, and this is sort of the difference, is we get a chance to interact with folks all day, every day, and into the evening. We get a chance to know them. We get to know their names, and they get to know our names, and we get to learn things about each other's lives. And it really creates a sense where many of these folks feel an inherent disconnection and stigmatism for their particular situation. Having that human interaction and those connections really makes a difference, I think, for everybody. And what it opens us up to is the opportunity to provide resources to folks for places to go and for contacts to make. And hopefully what will come out of much of the work of this levy is providing us and others that do interact regularly with information and material that we can give to folks. I had a long conversation with a gentleman yesterday who's trying to find housing, and he's trying to stabilize his situation, but he's at a loss in the sense of what to do and where to go. So, you know, any help that we can give is, you know, just I think is vital.
You know, when you mentioned that you get to know them and you get to know their stories, I think in our experience with the temporary safe outdoor space, it is relationship-based. There is no one-size-fits-all answer to ending homelessness, but when you get to learn, you know, what's going to work for the guy that you interacted with yesterday might not work for the typical houseless person in Missoula, the single mom with kids, and that's not going to work for the guy living on the courthouse lawn. So it is, Jim Hicks from Hope Rescue always says people don't become homeless because they run out of resources. They become homeless because they run out of relationships, sometimes even with themselves. And I think you just hit on it as a business owner. You know, what people who run the TSOS see is that you get to know them, their stories, what solutions might work, how they can help, you know, take that next step in their lives, which is impossible to take when you don't have housing. So,
right. Yeah, it's you know, it's the humanization of things. It's the humanization of things. And if I could communicate you know, we have many interactions, and we have lots of folks that are coming in that are experiencing instability. We have folks that are coming in that are experiencing crisis, and we have folks that come in that are sort of in between days there. And creating that connection with them is it's just a visceral difference in the opportunity that we have to make a difference. And you know, this levy, as it's going out to our community, I just really hope that, you know, in some way, that communicating that connection with a person and what the services that the mobile support team is delivering will do something to help us on that way.
thanks. Last but not least, Shannon. You are a business owner, obviously, longtime business owner, and you have gotten very involved in the crisis levy advocacy efforts. So can you talk about, you know, your concerns and why you are supporting the levy and playing this leadership role?
Because I'm crazy. A little tongue-in-cheek there, actually. Sorry about that. This is obviously very serious stuff, but you know, I think one of the things that brings me to the table is basically just that I'm a Missoulian and concerned about the community that I live in, and you know, I want our community to be a safe place, one that's a happy place for most of us to live. I realize that is defined by each individual, but homelessness, addiction, and mental health are working directly against those sorts of things. In our community, these things are obviously prevalent, and I've learned a lot working through this with everybody in the Friends group, and recognizing that over the past 2 years, there have been a lot of things that have been in place working for us to help us mitigate these problems. I think you have to be careful about how you define success and perfection, but over the last couple of years, we found that there is success in all of this. Things like the temporary safe outdoor space, things like the winter shelter, obviously the mobile support team, the crisis intervention team. These are all working behind the scenes in a way that in most cases you wouldn't even notice. Some of these services are working to keep people housed that are already housed. I'm looking to my right here, and I think that it's dangerous for us to define homelessness as one of the problems, because really homelessness can be kind of a transitional thing. So sometimes people are housed and they're only a step away from being unhoused. So let's do something to help them stay housed, which is one of the things that the mobile support team is working towards. The temporary safe outdoor space is definitely successful in helping people who are transitionally homeless find homes. If you talk with Jim Hicks, he can tell you the success stories, and we've seen some of them, and they're really heartwarming. They're difficult and they're edgy, but it's a success story for sure. So the other thing, one of the reasons why I'm involved in this, and it's crazy, because in my life as a car guy, I help people with their transportation problems. And one of the things that's just something that goes across everybody who owns a car, obviously, if you take care of your car, it generally treats you pretty well. If you wait for it to break down, it's more costly, and it's also more of a pain in the ass. So what we wanted to, what I look at this crisis intervention levy as is an opportunity for us to take an active role in solutions, which is going to be more cost effective for us as a community than waiting for things to break down. Once they've broken down, you're in a reactive mode, and things are always more expensive to take care of when that happens. So that's another reason why I feel like it's really important for us to come together as a community and support this levy. I recognize that it's expensive, but at the same time, to me, the value for services far exceeds the expense that we're talking about. So if you're going to pay for something and you get more value back for it than the investment that you make, that's a solid investment, and it's intelligent. And I think that this is one of those investments. So I'm convinced that that's the case, and that's another reason why I'm supporting this levy so strongly. And I could go on, but I think that probably covers as much as I need to cover, unless
Thank you.
anybody has questions.
Thank you, and thank you for reminding me that my car needs an oil change.
Preventative maintenance.
Preventative maintenance. Shannon mentioned solutions, so I'd like to ask each of you talk a little bit more about what you see as solutions to crisis in our county. What's working and what are the challenges we still need to address? And I'm going to start with you.
All right. So I think some of the successes that we've seen in our
Are you sure this is on?
might not be. I'll trade you.
It
Is it on? Okay. Talking too quiet. My kids would say that's not real. So really, we've done a lot of work in our community over the last few years with our strategic alliance, which is the the county, the city, and community stakeholders really trying to look at some of these interventions out in the community. And so some of the successes you've seen are around the mobile support team, the crisis outreach services that you see. And that's really where me personally, if I'm being selfish, what I would really like to see us working more towards with this levy is meeting people where they are. It's really hard when you're in a crisis sometimes for folks to just reach out to help. Maybe they don't have the supportive resources that a lot of us are benefited to have in our life. So meeting people where they are, that was for exclamation point.
There's a monster in the back.
Yeah. And then the other side around that is, making the resources that we do have beyond the outreach services more accessible. So a crisis stabilization center that works both for mental health and substance use issues, and trying to support folks with finding the resources that are out there beyond just going to an emergency department or waiting to see a therapist, as we see those times extend, or waiting to go to their primary care provider. So really trying to meet people where they're at is really where It really seems that a lot of both the research around the success of supporting communities, but then also things that we've seen within our own community that we've seen successes with. So really around that downstream interventions that really are creating access points where the people are instead of making people come to the access point, because that's an archaic way of looking at healthcare anymore. You know, as a community, if I have a problem, I reach out to one of my support systems. We need to create those support systems where folks are at.
Great, thank you. Jen?
Yeah, I think I want to really speak to our justice system and how so many individuals are kind of ending up in our jails who really, that's not a place to receive services, to get support with mental health challenges, with substance use treatment. That isn't really where we want them to end up. And that, you know, when we talk about really success as helping them heal and overcome those challenges, that's not the spot for them. And also when we think about cost savings, it's really costly for people to be in our jails. So on any front, that is not the response and that's not the role of our justice system. And a lot of my work is in restorative justice, which also looks at, you know, the needs of those people who are harmed by crime. Victims. And so, you know, when we, most of them, the needs are not met when people are kind of just moved into our justice system either, right? There are deeper needs for dialogue and conversation and meaningful accountability that could be found by diverting people and having more intervention that looks at bringing people together to talk about how, you know, how do we repair this? How do we make this right? How do we move forward? What do we want our community to look like? And how do we want to see you succeed in this space? So I think that is something that I would really like to promote us to consider is really what our, you know, our justice system and our emergency responders, like what are the intention of those systems and where really do we want to see, what other ways can we serve the needs without excluding people, isolating them and punishing them? Because that really in the end isn't serving any one of us. And I don't think even as, you know, business owners who at times maybe feel, you know, want to move people along, you still recognize people need something and just excluding them and moving them along isn't, you said that well, before, Matt, but that isn't really the response. So kind of diverting people from that law enforcement intervention.
I would echo what both Jeremy and Jen just said in all aspects. We have a great community resource officer in Missoula, Jay Gilhouse, who we have Jay's cell phone number, and he is always our go-to, as well as the mobile support team. And then we have visits from the HOT team and the crisis intervention folks as well. And to further that point of meeting people where they are, as wardens is concerned, we are where a lot of people are. And so we get that chance to touch them and understand their situations. And I mentioned it before about having informational resources at your fingertips to deliver to those folks. I realize so many times that a person in crisis or a person in experiencing instability is overarchingly a person that is trying to survive and trying to make their way and trying to get to a point of stability. We have many folks that we've had to politely trespass, for lack of a nicer term, from the business. And almost without exception, those folks will come back and they'll ask permission to be able to come in, and we'll have an extended conversation with them and what are they doing and how, you know, where are we at now as opposed to where were we at before, and we always try to accommodate. But like I said, just having some information to deliver that is perhaps harder to get to unless you have a caseworker or a social services organization that you can connect with is something I'd really like to see more of. And yeah, that's about my 2 cents.
Yeah, I'll just interject on that point of it is really hard to move forward with anything in life if you don't have a roof over your head, if you don't have an ID. I'm thinking about somebody who was at the temporary safe outdoor space and had a job but quit it because he had no place to take a shower. And he was smelling, and his coworkers knew it, and the customers knew it, and we were able to fix that situation. But it's just the sort of things that we take for granted. And again, that there is no one-size-fits-all approach. And so it sounds like good on you for building those relationships and helping people. I would also say, just from my own perspective as CEO of United Way and somebody who's worked with unhoused and marginalized people for over 40 years, that the overwhelming majority want just what we want, which is opportunity for a healthy and safe life for them and their families. And they are willing to take steps forward. Yes, they're like in the general population, there are people who aren't exactly heroic, but I feel like when we sort of dismiss all unhoused people as lazy or drug addicted or mentally ill or criminals, it's really doesn't reflect anything that has ever been my experience. John, talking about solutions and what you would, what would you like to see?
Yeah, I guess for us, again, support looks different. With unhoused individuals, people that have been through a lot of trauma, sometimes it's just being kind, giving water, connecting them to good resources like community care team, people that, because they don't have a lot of that support, that family support that, a lot of housed individuals have. A lot of times mental illness, sometimes the family doesn't understand what's going on, so support could look like connecting them to NAMI, connecting them to somebody that can help them understand that stuff. A lot of times we are a county resource, so for us, we go out throughout the entire county. Sometimes it's a phone call just to de-escalate somebody if they're having an anxiety attack or they're not feeling good, or connecting them to 988, which is, another resource that we have in our community
The
now.
National Suicide Lifeline with a local call center.
Yeah. So it's, support looks so different and it's so individual that, and again, I'm learning all this in the last couple of years. As a firefighter, I didn't really see all of this that way. And right now I see that of like, there's a lot of people doing stuff behind the scenes that we don't know about. Partnership Health Center is a part of our program. So we work as we hire clinicians that are Partnership Health Center, EMTs that are fire department, and we respond together as a team. And then they also take it upon themselves to try to connect them to resources beyond the hospitals and beyond, if somebody has an infection and doesn't need to go directly to the hospital, we can connect them to a primary care provider. We can connect them to other services. If somebody's falling, we can, elderly people falling, we can connect them to Missoula Aging Services and do that kind of stuff. And so there's a lot of stuff happening, and that's really why I'm here, is to kind of show what we're doing, who we're connecting with behind the scenes, because it's not just us doing the work. Without all of these other people doing the work, we will have a very hard time being successful. It is just going to be really difficult if we don't have somebody we can call on to then take them to that next step, because we're going to respond, we're going to be kind, we're going to treat them how they need to be treated. We're going to try to connect them to resources, but if those resources aren't there, it's going to be hard to be successful.
I think that collaboration, that's a great point, that whenever somebody says, well, there's too much overlap and too many nonprofits, I just don't see it. I see a web of people that work collaboratively, each in their own area of expertise, but all sort of pulling forward together. Did you mention the number of people that you are able to stabilize in place when you were talking before? And if you did, I'm sorry, I missed it.
I did not. We're over 60% of the time as well, and I'm pulling new data on this, but we are over 60% of the time we are able to actually de-escalate or work with that person and leave them in the environment that we found them. Hopefully with like safety plans and with resources and connecting them to people and doing warm handoffs. So a lot of times, after the crisis is de-escalated, we can talk about like what happens if this happens again. Who can you call? What are some resources? What are some support options for you? and really just kind of bring that to a level where they feel safe, we feel safe leaving them. We don't have to have law enforcement or fire EMS there for a lot of those situations, and then just kind of like check back in with them. So we have a follow-up team as well that is case facilitators that are out of Partnership Health Center that also, they will follow up with each one of our clients to make sure that we're connecting to resources afterwards and holding each other accountable. We work a lot with the hospitals and having difficult conversations with, I say hospitals because I see Jeremy here, but lots of people within the community. It's even with Partnership, we have difficult conversations on what we can do better. We have difficult conversations with the fire department on what we can do better because we all can do better and we know that. And we're always going to critique that to try to make sure that we're moving forward in this process. So I think that's something that we're able to do and really build this in our community.
Thank you. Shannon, you're a smart, insightful business leader. What do you see as some of the answers?
Well, maybe, answers-wise. Well, first off, without funding, these programs are going to disappear. So I think that that's one of the things that we need to identify to begin with as a community, to recognize that the American Recovery Plan Act, it's always a mouthful to say that, is going away, and it has funded these programs to this point. So I feel like, that's a solution or a pathway that we can't turn down and not support. In terms of just ideology and the way that I look at this and kind of from 30,000 feet, there are a lot of people working behind the scenes that are helping, people that are in crisis in our community. And, again, we have to be careful about the way we define crisis. It can look like the house is burning down or the door knocker doesn't work. It can be on a spectrum, and I think that that's important for us to remember. We've all been in those rooms or in that place in our life at one point in time where, excuse me.
This is one reason why we love you, though, because you feel this stuff.
I'm a crier. It's terrible. So anyway, we've all been in that room where we've needed a hand, and then somebody steps through the door, and there they are. And suddenly, you can resonate more strongly. You can be the human that you were meant to be. This is difficult for me because, in a lot of these conversations that we've had around town, people don't recognize this. They don't recognize that the guy that's in the doorway is not trying to be in the doorway. They come to this place where, there's all these crazy people out there, and homeless people want to be homeless, and crazies want to be crazy, addicts want to be addicts, and they want to stay that way in their life, and that is not the case. 95% of the time, I would say. So we have all of this evidence that points to that, and we need to recognize that. And it's frustrating to me to meet people in our community who are closed off to that. So that's why this becomes kind of an emotional issue for me. If, as a community, we want to resonate at a high level, if we want to be the place that we all imagine Missoula to be, we're going to need to recognize that we need to put a hand out, put our boots on the ground, and do some work and help some people. And that's what this levy is all about. So that's what I'm here for, again.
Thank you. That seems like a really great way to transfer to, we could talk all day just among ourselves, but we really want to hear from folks in the audience who have questions. And we have a microphone up here. And maybe Alexa would bring the microphone to somebody if they had a question. We have somebody. Yeah. And you can direct it to anybody or the whole group.
I have two questions. One, I have a downtown rental property, and often there's homeless people on the front porch. And I tell my tenants to call the police, but just from hearing you guys, it's probably not a good thing to do. Who should we call?
Right, the Poverello Center's HOT team, Homeless Outreach Team.
Okay.
You'll see them out and around in their orange sweatshirts, and they are an amazing response. I mean, Matt, do you want to, I'm sure you've called the HOT team before.
Yeah.
Certainly we have at
Many
United
times.
Way.
And we're very lucky here to have a number of resources to call depending on the day of the week and the time of the day. The HOT team, the Jay Gilhouse, like I said, mobile support
He's the
team.
downtown police officer.
Yeah. And if you feel the need to, if you have a marginal situation, Jay is a great resource because he can very quickly identify if he's the guy to be there or if he needs to bring some other folks in.
I mean, if anybody is feeling imminently unsafe, 911 is the call to make. But if it is just like have somebody come assess the situation, figure out a better place for them to be, the HOT team does amazing work and is funded in part by the city for this work.
And can I have a number?
Yeah, I can provide you the number.
I can provide you with the number right
Okay.
now, and for our listeners.
Yes.
Something great about the HOT team too is that they participate in a lot of the coordinated efforts in the community. So if they maybe aren't familiar with that person, they probably know somebody that has worked with that person before. And so it's just also a nice way to probably de-escalate the situation, and that it would be somebody probably coming that that person's seen before too.
Okay.
Yeah.
And our audience member touches on the sort of coordinated entry system that has been so instrumental in improving the way that Missoula addresses homelessness. That there is weekly conferencing, a by name list where we talk about, Jeremy has this issue and Jen has this issue and who needs housing first or who's in housing but needs some help to stay in housing. So the HOT team phone number is 406-493-7955. 406-493-7955.
Thank you. And my other question, or I don't even know what this is, but I've read numerous articles about tiny home villages to get people off the street, get them an address, get them working, have social services, and then having them move out and be self-supporting. Has Missoula ever thought about doing anything like that?
Yeah, that is a great example of the kind of programs that the city and county are working on and that we want to bring to Missoula. And it's, I think, frankly, supporting the levy means that city and county resources can go into longer term solutions like that. They are working on projects exactly like that. And of course, land is a challenge. I mean, you have tiny homes, but you have to have a place to put them. They have to be hooked up to sewer and, on the grid, sewer, electricity. I just was making some notes on a story that I had read about tiny homes. That's why I'm looking at my phone. But passage of the levy helps stabilize people and get them immediate help and frees up resources for longer term, more sustainable, appropriate solutions. So yes.
I can also add that
Here,
the
give,
temporary.
take the mic so that MCAT can.
Just to add on to that, the temporary safe outdoor shelter that's currently tucked over on the way to Lolo is moving, and that's going to be moving over to the new Trinity Center property that's next to the jail being built, and that's actually going to be pallet homes. And so it is that model of the small little homes. Pallet is the company that builds them, but I
Yes.
can't remember the number of homes, but it's also going to serve more people than the program currently does. So that model is being
That is a great
and I
point.
think
Thank you.
they're starting to move people over there, like at the end of November, maybe.
That's the target date. And so Pallet Shelter, and you can go to their website, palletshelter.com, and see a video of what these shelters are. They are heated in the winter, and they have air conditioning in the summer, and it's a very simple structure with a bed, a desk, a lamp. But they are much more better for our climate than tents. And honestly, for some people at the temporary safe outdoor space, they say it's the best place they've lived in a long time. And think about it, they're in tents on a platform in a field. So this will be a sort of more humane, and I think you're right, the folks from Pallet Shelter came to town recently to teach us how to put one of these structures together. And the plan is to transition to a more central location from Highway 93 at the end of November, beginning of December. Everyone's very much aware of the change in weather and how important it is to get people into a better situation.
Just to add to that a little bit, one of the things that the temporary safe outdoor space does as well is align people with services that they need for success in their lives, essentially. So if they need an ID, they can help them with that sort of thing, social services alignment as well. So we find that, again, Jim Hicks is the person that I first heard say this, is meeting people where they're at is kind of what needs to happen. So not only do we have shelter for them, but at the same time we can provide them with services that they need to move out of that and transition into more permanent housing and then be a better contributor to our community, essentially. So I know that that was one of the parts of your question as well.
And I would definitely say that the sort of ethos at that place is if you don't want to play by the rules and you don't want to move on or, up in your life, then you move on. Then the TSOS is not the place for you. But but the people who are there and who have successfully gotten into housing or reconciled with their families, or a few have gone into treatment, the ones who have gotten jobs, succeeded and are no longer homeless are the ones who really worked their program and wanted to take responsibility for their own lives. And I think that is another stereotype that Shannon mentioned, that, we sort of assume that people choose houselessness, and that I'm not going to say that nobody does, but I've yet to meet somebody in 40 some years of this work that's their preferred way of living.
Sorry, I don't mean to monopolize, but I have a 3-family near the Good Food Store, and it can easily be turned into a 4-family providing a studio apartment. And the city would not let me do it. I tried to get a variance. They just were not having it. And it's not changing the structure outside. It's just closing up a doorway and turning a 3-bedroom into a 2-bedroom and a studio. And it drives me crazy because they just wouldn't let me do it.
You've hit on something that I think is a challenge nationally, and that is rules and regulations and policies that I think our city is taking a look at, trying to fix those. This is not the first story that we have heard about, delays or things that don't seem to make sense to us. And I do think that we have a pretty enlightened city department looking at these issues. But like any big bureaucracy, things don't always go the way we want. But I'd love to talk to you about this after class.
Yeah, trust me, I know it doesn't go the way you want. Yeah, I have another project where I just decided to do a communal living space. It's a 3,500 square foot apartment, and I house 6 people there, 6 to 8. And I bought it in March, it's still not finished. I mean, it's done, but it's not, I can't move people in.
Yeah, that's
Because
very
inspections
frustrating.
And, oh, you didn't do this, oh, you didn't do this. I'm like, why didn't you tell me
Yeah.
all of this in the beginning? I'm ready to do it, I want people in there, and it's just frustrating.
Yeah, I will say it's not my area of expertise, but I do know that a lot of eyes are on these policies and trying to address them to be more responsive to issues like yours.
Yeah, and I'd love to get more involved in getting things moving.
Well, that is what we're all about, is getting people involved in solutions, so thank you.
Okay.
Other questions?
I have 2 questions. The first one being from me, the second one being from my boss who's not here. But my first question is just, I live downtown and I see a lot of houseless folks on a regular basis, like the same folks. And I think that I have probably the viewpoint of a lot of people where I'm concerned, but also have these natural biases to be a little bit afraid of houseless folks, and that's something I want to challenge within myself, and so that I can maybe lead up to direct action. And I just wanted like maybe advice on literature or like entry level things to get into this issue, to like break that.
I just want to say, in most cases, research shows that people who are experiencing housing insecurity or who are currently homeless are actually more likely to be victims of crime than to actually be perpetrators of crime. And so I feel like they get portrayed as, unsafe, and that's that stigmatization that I think we want to challenge. And it sounds like you're ready to kind of challenge within yourself. And so I really commend you on kind of recognizing the bias that you have. As far as like initial ways to get involved, I'm curious to hear what you all think.
I'd say just, I know, I was like, no, I guess for me it was, fortunately my position exposed me to working with clinicians and working with other agencies. And I would say, there's the Poverello and the Johnson Street Shelter. They have opportunities to volunteer and to work there and do shifts like that and really get to know the individuals on a personal level. And that's something that I like. I go down to the ACS, authorized campsite, to meet with other providers and to meet with the people that are living there, because I think it's really important that we hear their voice. And again, there is a lot of stigma behind all of this. Working with clinicians, seeing somebody that's hearing voices can be scary if you don't know what's going on. But there is a lot of research and it just needs to be educated across the country of like, this is something that like they're suffering with. They know they're suffering from that stuff. And the likelihood that we're going to be harmed in that is pretty unlikely, honestly. And there's ways of, distance, and there's, you have to, the way you approach people and the way you communicate with people is really important. And there's a lot of that education in volunteering at, the Poverello or places like that.
And I would also make a pitch for the Housing Advocate Network through the Missoula Interfaith Collaborative. That takes people just like you and me, and we walk sort of hand in hand with an unhoused person seeking housing. It can take months, they can have myriad challenges, but it really lets you get to know somebody's situation and makes you an advocate for them to get into housing. It's a really wonderful program. They need more and more volunteers, and it's a commitment, but that's how we end houselessness, is one family, one individual at a time. And that's MissoulaInterfaithCollaborative.org. Zeke Campfield is the gentleman who runs that program. And I think they have 40 to 50 HAN, as we call them, HAN volunteers, but they could use many more. I just had an experience the other day leaving the Top Hat after lunch with a gentleman sitting on the street with a dog, seemingly, clearly to be homeless. And I thought, I've just, in the old days, now that I'm old and know everything, I would have, skirted, walked another way. But I have challenged myself, as you said, and I made eye contact and I said hello. And I was wearing this Halloween scarf with like gold skulls on it, and he was like, "I love your accoutrement." And it was like, as I was walking to my car, I was like, the last person, talk about stereotypes, the last person I would have thought would have used the expression, "I love your accoutrements," was this gentleman. The other day I was going into the courthouse for something. There's usually a cadre of people on the courthouse lawn. And again, I walked by and somebody complimented me on what I was wearing. And I said, "Thank you very much." And I said, "I got this. I've had this for years, but it still holds up." And we had a little conversation, and she said, "Thank you for talking to me. Most people just walk by." And I said, "Well, I see you." And then when I came out again, she was there and she waved to me and I waved back. And it is those little moments where you build relationships that make you see beyond sort of the obvious and see people as not the homeless, which is something I've spent my entire life trying to disabuse people of this term that there are the homeless. No, they are people who are experiencing homelessness, and every single one of them has a different story. And it can be difficult and challenging to learn their stories, but they deserve it, I think. I should check time.
You had another question.
Oh, yes. Question. Sorry.
It's from my boss. I think she's
Oh,
watching.
yeah.
She's not here. It might be kind of an intense question, but I'm just going to read it straight off of what she sent me. And thank you for your answers. They're very gracious.
Sure.
I 100% support the idea of the crisis intervention levy, but I have some concerns. In the October 13 Missoulian article titled "With Authorized Camping Site Closing, Official Stress Need for a Crisis Service Levy," the list of potential programs it will fund at the end of the article seem to be entirely housed in the sheriff's office. This is concerning because of the past reports the sheriff's office hired and did receive training from Oath Keeper and Constitutional Sheriff Rick Whitehead and Killology Research Group per the Missoulian article of May 11th. Yes, the city canceled our contract with these folks, but not before having our personnel go through some of their training, according to the sheriff's office spokesman, Jeanette Smith. So my concern is it proper to have the most vulnerable among us served by people who are being trained by racists? The article states that Whitehead, also made fun of women and showed a photo of a police car with LGBTQ flag printed on it, and then, according to Ramsey's email, asked the class, what's next? We have to have a Muslim flag to satisfy the goat. Has there been an accounting of this wrong? How will we trust our responders will not be acting with these views? And finally, has the city or county done anything to remediate this awful training? I don't know anything about this, but that was...
Nor do I.
Okay.
I can just say that I can't speak to, actions of the sheriff's department. The programs that I am familiar with that could potentially be funded by the levy, I would say it is a misconception to say they are housed in the sheriff's office. The things like the temporary safe outdoor space, the emergency winter shelter, crime victim advocates. I just don't think that that's accurate. And that's all I can say. It's not my area of expertise.
Right, I would agree with that in terms of just the way that I'm coming into this. A lot of what is put into play is with the city or with the county, the sheriff's department, the fire department, and that sort of thing as well. But there are a myriad of nonprofits that are working on solutions for these sorts of things as well. The POV was not mentioned. They run the winter shelter, Temporary safe outdoor space is overseen by Rescue Hope Mission. Is that right? Rescue, thank you. I always get it mixed up. I'm terrible with names.
Missoula County.
Right, exactly. So what we're really finding is that outside of the sheriff's department and city organizations, there's 14 different organizations that come together for, the programs that we're talking about. And most of those are not, city employees. Yeah, so I think that is a misconception. As well, in terms of, just dealing with the issue of, contracting and that sort of thing, it is fairly evident that the sheriff's department is not doing business with those people anymore. So I think that the sheriff's department does take those sorts of things very seriously because they have to, they're here to represent all of us, and obviously they're improving daily as well.
I was just going to say on the responder side, just informational, we are working closely as far as like firefighters, law enforcement, and actually clinicians. Our mobile support team goes through CIT training. So we do go through CIT training.
Crisis intervention training.
Yeah. Yes, which is the crisis intervention team. One component of that CIT is training. That's not all of what they do, but we do all go through that training. And there's a lot of individuals that have done that, including sheriff's department, police department, and there's people throughout the community that are part of that. So there is stuff happening to move that, to make sure that us as responders are responding appropriately to people, especially with mental health crisis, but to everybody.
Any more questions? Yes.
Thank you all for sharing your experiences. I think there's a very compelling case for the levy, but I also recognize that there's a lot of concern in the community regarding inflation and rising taxes. So what would your response be to people who don't want to shell out for the levy?
Can I say something too?
Sure. Do you want me to go first, or do you want to go first? I actually think that the expenses of doing nothing far outweighs the investment. And I just keep going back to that in my mind. So, you know, putting a value on human life is a difficult thing to do. And we haven't had a death in Missoula over the winter due to exposure because there's places for people to go. So doing nothing is going to be far more costly, and it's going to cost everybody here. I mean, we are all each other's consequences in this room, and it's just going to be one of those things that we're going to have to bear whether we like it or not. The other thing that's difficult is in situations where there's inflation and things get to be more expensive, we find that, those that are on the fringe and are at risk are more at risk. So the problem is magnified by inflation, not minimized. So, now is the time, in my opinion, to strike out and go ahead and do something about this before it gets to be so expensive that you want to move from Missoula because you don't like living here, So those are the things that I'm talking about, yeah.
And I would only add that we have very limited options. We have no other options other than property tax. That is, the legislature has seen to it. And I think there is an argument for tax reform, but for right now, property tax is the way that we invest in programs like this, because it's the only vehicle available to us. I know there are people, I hear sometimes we need to cut this and cut that, but I have yet to find somebody who can really identify something that they would want cut. So I agree with Shannon.
One of the other things that I think is worthwhile pointing out is if you live in a house that has a taxable value of $400,000, this is going to cost you $108 a year. So if you're a subscriber to Netflix and you watch it once a month, you've just paid for your share of the levy if you cancel your subscription. So some of these things, expense is definitely a hot button right now in the news because of inflation and everything like that. Everybody's worried about the economy, but we're talking about $10 a month or less. So I want to be absolutely clear about that, because when we hear about property taxes going up and everything like that, they're going up. This part of it is not that expensive. And the advantage or the benefit that you get back, for me, that's worth $10 a month. And it doesn't even cost $10 a month, to be honest. So, yeah.
And then I just wanted to add that, so a lot of these programs, I work on the community care team at Partnership Health Center, and we have one of our street nurses here too who helps a lot of folks. So also, a lot of our programs, mobile support team, our program, a lot of others, we in the coordinated entry, we are able to identify people in the community who are high utilizers of the ER, who are high utilizers of jail, and we're really putting a lot of effort towards focusing on some of these folks to divert that to going to partnership for things and whatnot. So really, a lot of these programs are actually saving a ton of money of emergency service that are used in our community that probably, I don't have the numbers or the math, but I know that data exists, that we're actually saving a ton of money because a lot of these folks that we're connecting with aren't going to the emergency room as often. they are getting medication from somebody like Rachel to help them stabilize so that they're not having to go, or MST isn't having to be called as much for certain people, and they're able to like have enough, stabilization to go to their doctor's appointments or things like that. So I think we're actually, putting this money in now is going to be helping save a lot of costs in the long run too. And really trying to identify those people, because there's only a small amount of people who utilize a lot of those resources and are utilizing the ER every day or whatever, and so we're really trying to work with those folks also.
Thank you. Yes.
It's very short. Susan, thought I could yell. Susan, would you, is that working? Yeah. Would you explain a little bit more about this coordination entry team? I would think it would be super
Sure.
important, considering all the 14 entities that you're going to
You ladies
work
can correct me if I get the, I'll give you the broad overview. The Missoula Coordinated Entry System is an organized way and a no wrong door approach of assisting people who are unhoused or about to lose housing. So instead of a bunch of individual organizations in their own silos not working together, coordinated entry system, there are definite points of entry where if you are unhoused or at risk of losing your housing, you call, for example, 211, our local information and referral hotline, and you are instantly entered into the coordinated entry system where your needs are assessed, the severity of your situation is assessed, and caseworkers and frontline workers take it from there. In the old days, it used to be a more chaotic system where whoever had the most fervent social worker would get housed first, even if that person's need wasn't as bad as somebody in a more severe situation. They also are devoted to sort of continuous improvement, training, following national best practices, and perhaps you two ladies could articulate more about coordinated entry than weekly case conferencing, as I mentioned earlier, one for veterans and one for non-veterans, and this by name list where they know their clientele. They know who can, maybe if we gave so-and-so first and last month's rent and a security deposit from United Way's Housing Solutions Fund, they could get into housing. So-and-so has a utility bill in arrears that's preventing her from passing a credit check and getting into housing. We could fix that. So-and-so has family in Polson that they want, and she wants to reunite with them and they want her to come home. She needs a bus ticket. So individual situations through this coordinated system where everybody knows everybody's clients in a way. Jen.
I just wanted to add that I think what the Crisis Intervention Levy is planning to fund and is currently happening in our community is kind of a necessary piece to make the coordinated entry system work effectively, right? And so it's like we need all of these pieces and the synergy of them all working together to actually address community members, families who are struggling's needs. And so you could say like, oh, we already have all these things. And it's like, we kind of do. And this maybe are some of the missing pieces that are gonna help it be the most proactive, effective, best practice that we see in communities across the nation. So I'm really proud of Missoula that we have knit together all of these different units and collaborated in such a way to start to see the results, in the lives of our community members.
So who at this point would be the head of that coordinated team?
It's actually, I believe it's Emily Armstrong and Samantha Hilliard, yes, with the city's Office of Community, I can never get the name right, Office of Community Development and Innovation. I think I'm missing something. Community Development Programs and Innovation. The department in the city that's run by Aaron Pahan. But United Way also funds some of the training and the continuous improvement workshops. And we have, as I mentioned, the Housing Solutions Fund, which is administered by 211, the information and referral line, so that caseworkers who have a client who needs money right away, it's a flexible fund that can be used. We call it a diversion fund. So it prevents people from going homeless. It diverts them from houselessness with relatively, I think the average expenditure is about $450, and it has helped close to 200 families over the last couple of years get or stay in housing. With that, I want to thank you all. Thank you to our panel.
We have one question back here, if it's really quick.
Whoops.
If
Can-
you don't have time, it's fine, I can ask afterwards.
Okay, we're gonna, I think we should wrap up and we'll be available afterwards. Thank you, panelists. Thank you all for being part of this important conversation. We have folks from our levy passage campaign here. There are flyers on the back table. There are yard signs if you're so inclined. Our website address is savinglivesandmoney.org with the A&D written out, savinglivesandmoney.org. You can find out more information and get involved if you would like to do that. Thank you again, everyone, for being here, and please be sure to vote on Election Day.